and welcome everyone to this very special show. We at Network 18 have partnered with the Serum Institute of India for this nationwide campaign Swasth Immunized India in order to spread awareness about immunization and to protect our children against vaccine preventable deaths. Today we are in Mumbai at BMC's Worli Seaface School and we are being joined by Maharashtra's Education and Tourism Minister Aaditya Thackeray, one of the youngest politicians of the country and a youth leader. So Aditya, thanks a lot for joining this campaign and thanks a lot for lending your voice. How do you see immunization as an important step?
It is a very important step, and for especially kids, growing up in that age, of course all of us are scared of vaccines when we see vaccines, and I remember running around. But in terms of oral vaccines, in terms of basic vaccines, oral drops, these are easy measures we can actually take to prevent child mortality. So it's extremely important that we get every child immunized with these basic vaccines, be it for polio, be it for rotavirus, be it for measles, all of that. So it's crucial.
Generally we ask young parents about their experiences, but as a young leader, do you have any memories of your childhood immunization or Tejas's immunization for that particular
I turned to be an athlete when I saw a vaccine in my doctor's hand, and I used to run all over the place. So it was I remember those were moments where I was like, okay, I'm going to sprint the fastest away from him. But I think that moment is what makes our life better later on. So even this whole campaign that the government has run for so many years now, the success that we've achieved in polio, eradicating polio, I think people spreading awareness. It's very kind of you to call me a youth icon, but I think people who are out there on the ground going and immunizing, or giving those oral drops, I think those are the real champions, and people like you and the channel who's doing this, I'm really thankful to you, because see, as governments we always have policies. We have policies that we want to reach out to the common person, to the last man, last woman. But again, for us to reach out there and to get an effective feedback, whether it's reaching out or not, you are the effective medium for us to go there.
But do you think that there have to be more discussions around immunization? For example, you have many young leaders around you who possibly have very young children. Are there any times when such conversations happen between you about immunization?
We talk a lot about healthcare. I mean, with the mayor here also, Kishoritai, and with anyone else who's within our sphere of talking. One of the first topics that comes up is about healthcare, because you go to any urban center, any rural center, it's about primary healthcare, decentralizing hospital services to smaller, dispensaries. Along with that, of course, immunization is one of the major factors. We haven't really spoken, to be very honest, only of that topic. I'm very happy that you brought this up, because this is an important feature of the entire healthcare. Again, one of the most important things is if you can actually give vaccines to kids at that age, the burden on the exchequer later for diseases which can be prevented is much lesser when you do this.
Yes, so I'm hoping that after this more conversations will veer around immunization. And primarily what I also want to know from you is that Maharashtra in particular, in terms of the general wider coverage for immunization, lags behind in terms of the national average. Why do you think that happens?
I think that is crucial to know why that happens, but as someone who's 29-year-old, someone who's just inducted in the cabinet, it's very important that I take this up with the government and reach out. See, overall in the past few years also, the health spending of Maharashtra has been not as much as it should have been according to the world standards. You know, normally it's about 8% of the entire budget. We are around at 2.5-3%. So obviously we need to up our standards, we need to up our game. And I think if, with people like you coming on board with channels, I think it'll be helpful, because finally awareness is created through you. We campaign, we do all our electoral campaigns through you. Now that elections are over, I think it's important for us to connect again and move beyond politics and start doing these things which are crucial for our society.
आप क्या रोल अदा करती हैं, आपका काम क्या होता है, ये क्या है, हमको काम समझाइए।
हम लोग एवरी चिल्ड्रन को 0 to 5 years का प्राइमरी इम्यूनाइजेशन इज़ वेरी इंपॉर्टेंट, और घर घरों में जाके हम लोग लीस्ट निकाल के, ये बच्चा डिफ़ॉल्टर रिया तो भी वो बच्चे को हम लोग निकाल के बुला के, क्यों हम लोग सेंटर में डोर टू डोर जाके वहाँ पर हम लोग कैम्प करते हैं और बच्चे को इम्यूनाइजेशन का कवर्ड करते हैं ऑल डिजीज़।
एक हफ्ते में कितने घर आप कवर करते हो?
एक हफ्ते में एटलीस्ट 7,000-8,000 हम लोग कवर करते हैं सब CHV. असं 66,000 पॉप्युलेशन आमच्या एरियामध्ये आहे, आणि त्याच्याप्रमाणे आम्ही CHVनं अलाउड केलेलं आहे विभाग।
सर हमको बताइए, ये जो बॉक्स है इसका क्या सिग्निफिकेंस है?
इसमें हम वैक्सीन रखते हैं ताकि जो वैक्सीन होते हैं उनको एक पर्टिकुलर टेम्परेचर पे मेंटेन रखना होता है, तो इसमें टेम्परेचर मेंटेन रहता है, कवर्ड रहता है इसके लिए।
Whenever there is a movement, I am a strong believer that rather just having it on policy papers, we need to include the people into this movement, make them a voice for us.
Welcome back to Swasth Immunized India. We at Network 18 have joined hands with the Serum Institute of India to spread about the importance of immunization in the country. Right now we have a panel discussion about the condition of immunization in Maharashtra and in Mumbai, and we are being joined by none other than Maharashtra's Cabinet Minister for Tourism and Environment, Aaditya Thackeray. We also have Dr. Sheila Jagtap from the BMC, a health official, and we have Dr. Vivek Pardeshi, who's from the WHO. He's the surveillance medical officer. So with this and a lovely audience of parents and health workers and some children as well, we are going to discuss about the importance of immunization. So Aditya, coming to you first, we've seen that due to several misunderstandings, lack of communication, or there are certain misgivings within the parents as well, certain campaigns have also not done that well. So we've known that when the state introduced measles and rubella in 2018, there was a lot of concern and misinformation, and that is why though the target was 95%, Maharashtra could achieve only 90%. Then there was rotavirus in July 2019. That vaccine was introduced by state government. Even then there were concerns and the state could not perform all that well. Recently, Chief Minister and your father Uddhav Thackeray also announced preventive vaccination campaign against pneumonia in 5 districts. Now these are 5 targeted districts, primarily tribal districts. We talk of Palghar, Nandurbar, Gadchiroli, Amravati, Nashik. So we have seen this consistent experience. What is the state government planning to do in order to ensure that there is last mile connectivity?
See, I think primarily what is very important for us to understand is this is a major movement for us, because this actually gets rid of the preventable diseases, or it prevents diseases that can come into an entire generation. Most of the success that has happened, I mean, even the fact that we've reached 90% out of 95%, or we had 58 out of 62, I think the success is entirely the credit of the Arogya Sevikas or Anganwadi workers who go house to house, door to door every single day, taking all the effort to try to convince the parents to immunize the child, give vaccines or oral drops. But I think it's very crucial that the misinformation that is carried around easily, especially in a highly techno-savvy state like Maharashtra, where our digital literacy is extremely high, technology penetration, internet penetration extremely high. In these cases, I believe we need to have a two-pronged approach. The first one, of course, is to go through the same means that spreads the misinformation and spread information, which is Facebook, WhatsApp, and if you see, most of the government departments now are getting active on social media. So I think that is one, and the other is one of the successes of BMC in controlling malaria or dengue has been always, before major festivals like say Ganpati or Navratri or any other festival, we call all the mandals. CM Uddhav ji, the mayor, all our healthcare workers, the whole department actually addresses them. And we start an awareness campaign through these mandals. Plus, in a city like Mumbai, Pune, Thane, Nashik, the urban centers, we've got ALMs, NGOs working. So we've got to include all of them now as a part of this movement. See, any movement in Maharashtra, any movement across the country today, for example, even something like, say, single-use disposable plastic. Whenever there is a movement, I'm a strong believer that rather just having it on policy papers and trying to implement through government, finally government is for the people, with the people, by the people. We need to include the people into this movement, make them a voice for us. I think that is very crucial.
You talk of people, you also most importantly talk of your Anganwadi Sevikas and the primary health workers who offer these services to people who go door to door. Interestingly, we have some of them here in the audience, and if we can ask one of them about what their experiences are.
हम हर रोज़ मतलब जाते हैं ना, घर घर डोर पे जाते हैं, तब हर रोज़ भी मतलब बोलते हैं हाँ वैक्सीनेशन के लिए, अगर पोलियो के लिए, अगर प्रेग्नेंट भी रहेगी तभी भी 3 मंथ्स के पहले ही हम रजिस्ट्रेशन करते हैं बीएमसी में. कोई अगर ना बोला तो हम एएनएम को लेके जाते हैं डोर टू डोर. अगर उनको भी कन्विंस करके नहीं हो रहा है तो हम डॉक्टर और पीएचएन को लेके जाते हैं, और वो तो कन्विंस होता है उनसे.
You know, these are the health workers who say that there isn't much of a rejection in the areas where they go. But we also have BMC's health official, Dr. Jagtap, with us. Doctor, we've seen that particularly in Mumbai, the percentage for vaccination, overall vaccination is not all that great. What are the challenges that you face for this?
We do face some challenges in motivating the parents to take vaccination, and one of the important aspect of that is still immunization or vaccination is not the priority or the health need for the parent. I would like to share one experience. We are conducting a Mission Indradhanush 2.0 round, and in the last round, the second round, which was held in January, I visited one of the areas, and the mother, she was convinced about vaccination. Our health worker had told her that on such and such day there is a camp, and she must take her child for vaccination. But when we actually visited her house, she was busy washing her clothes. So for her, because the water supply is intermittent, so for her the priority was completing that household work and not taking the child for vaccination. But I must proudly tell you that one of our CHVs, the health worker, she actually went to her house, she picked up the child and she told her, "Bhabhi, chalo, abhi isko vaccination dete hai." So this is the kind of work our CHVs are doing.
आज यहाँ पे हमारे साथ काफ़ी पेरेंट्स भी मौजूद हैं जिनके छोटे बच्चे हैं 5 साल की उम्र तक के. हम उनसे भी पूछते हैं कि क्या वो अपने बच्चों को लेके जाते हैं इम्यूनाइजेशन के लिए, या क्या आंगनवाड़ी सेविकाएं उनके दरवाजे पे आती हैं बताने के लिए कि क्या इम्पोर्टेंस है इम्यूनाइजेशन का.
बहुत अच्छा लगता है कि वो खुद से अपने घर पे आके अपने को हेल्प कर रहे हैं. अपने को किधर जाना नहीं है पोलियो के लिए, किधर लाइन नहीं लगाना है, अपने को बच्चे को लेके नीचे दवाखाने में जाके उनको पोलियो डोज देना है.
But we've seen that there are certain reservations as well that parents have when it comes to immunization. And we have one such couple who has come here because they thought that immunization was not that important until unfortunately their child was struck due to an illness. Today, let us hear what they have to say about that.
वैक्सीनेशन मिस होने की वजह से फिर ये हुआ उनसे एटलीस्ट को डिप्थीरिया का इन्फेक्शन हो गया था. इट वॉज मतलब बहुत डेंजरस था. फिर उन्होंने हमको फिर पूरी तरह से गाइड किया कि आप इसको इम्यूनाइजेशन पूरी तरह से कराएं. टीकाकरण था और हमने वो टाइमली फिर इसको इम्यूनाइज कराया. तो ये है कि अल्लाह के शुक्र से फिर ये रिकवर हो गई.
तो आज आपको क्या लगता है इम्यूनाइजेशन के बारे में, वैक्सीनेशन के बारे में, आज आपको क्या लगता है, क्या आप लोगों को बताती हैं उसके बारे में?
ज़रूरी है वो सबके लिए, बच्चे छोटे हो या बड़े, 5 साल तक तो ज़रूरी है देना.
You know, in Mumbai particularly, we also see there is a lot of floating migrant population. How does the MCGM track such population, and how do you ensure that the children of such migrant laborers are also vaccinated?
Wherever there are these sites where the floating population resides, our health workers, we actually go and conduct a camp over there. So the health worker from the G0 team, they will go there, they will immunize those children. They also give them the MCP card, which that is the mother child protection card, on which whatever vaccine is been administered on that day, and which is the next vaccine and when is the next vaccine due, that date is also communicated to them.
Aditya, one more thing that has come through all these discussions is the pivotal role that the health workers play. They actually act like a foundation of the entire healthcare system. We've seen in the past as well that there were certain unhappinesses, particularly about the ground level staff that works, may it be ANM, may it be Asha Didis. Does the state government plan to bring up any incentives for these workers who
So
play
just
this
last
role?
year, I think their wages were increased by a couple of whatever the pay scale is across the state. About the municipal corporation, there is a larger thought process about increasing their pay scale as well. But you're absolutely right that when we speak about the whole system, these women are ignored the most by the system, and these women are actually the ones who are running the system and reaching the system to the last person. So we should actually be starting from them and then move upwards.
That's a very strong commitment that comes from you then in terms of
We should
understanding
be,
this.
because see, finally what happens is our approach is top down, but when we realize that the person at the bottom of the pyramid is reaching out to the maximum people, we need to look after their families, their healthcare, what their interests are, and more or less the government has been looking at that.
One more point that has come through the discussions is also, the kind of misunderstandings that people have, particularly about vaccination, and the challenges that the social media has posed these days are tremendous. So, what are the ways in which you are planning to take care of, the hurdles, particularly with respect to fake videos or, the social misinformation campaign that goes around in the social media? Do you think that's a major challenge for the government to tackle with, and how do you look at it?
I think one of the most crucial endorsements we normally get is from the WHO. When people say it's WHO approved, that helps to break a lot of barriers, right from your rehydration sachets to vaccines. Whenever someone sees a WHO stamp on it, a WHO endorsement on it, I think that eases out a lot of concerns. But that is also amongst a particular class that knows WHO. But for us, that we need to speak about this, like I said, the mediums that are using the misinformation, if we use the same medium, if we reach out through movies, through films, through adverts. For example, couple of years ago, Mr. Bachchan became the brand ambassador for polio, and Do Boon Zindagi Ke, that became a household line. I think success stories like these can actually help us learn of how to break this misinformation campaign.
So, on that note, let me also turn to Dr. Vivek Pardeshi. So, you represent the World Health Organization here. The World Health Organization feels that India is among those 10 countries which need to intensify its efforts for immunization. What do you think are the efforts that should be taken in order to ensure that immunization is a fully covered thing?
So over the past 6-7 years, multiple efforts have been put in by the government. For example, additional campaigns, catch-up campaigns like Mission Indradhanush. Then increment incentives for the workers who are working in the field. Increase in the number of workforce. Literally every inch and inch of the city has been covered by the corporation. Every house, these didis, they have got one key word, the kulja seems like bhabik darwaza kholo. And that is the key to reach each and every house. It is happening. But being such a huge country, one thing is awareness among the parents. A healthy child getting a prick, that is the first hurdle. So making the parents aware is the first key. That is also has been discussed by the Honorable Minister and our Madam. Second thing is the things which are available free of cost, generally they are not valued. the best quality vaccine, the best quality cold chain happens and available over here.
One last question I want to ask you, and that is that, you mentioned about Mission Indradhanush. There's also intensified Mission Indradhanush 2. What is the kind of response that you have seen for both these efforts?
I'll tell you in the percentage. Before the first Mission Indradhanush campaign, the coverage was hardly 65%. Over the past 4 years, it has gone multiple folds. And this coverage has been increased only in those pockets where there were gaps. The poor or underserved pockets, maybe because of the distances, maybe because of the myths, these pockets are picked up.
Lot of efforts are being put in by the machinery in order to ensure that awareness is spread about immunization. I would like to thank Aaditya Thackeray primarily for sparing his time for raising awareness on immunization.
Thank you.
I would also like to thank Dr. Jagtap and Dr. Pardeshi for being a part of this endeavor by Network 18, and thank you all for participating in this effort.